Start. Hi, my name is Amaka, and I'm a family nurse practitioner student, and I'm here to do a head-to-toe assessment on you. But before I continue, I'd like to seek your permission to be able to record our conversation. Is that okay with you?
Yeah.
Okay, fine. So what's your name? I want, first of all, I'd like to know your name.
Lieutenant.
Okay. And where is this place?
We're in the clinic.
Good. What is the president of the United States of America?
Donald Trump.
Very good. So, right now, I have confirmed that my patient is alert and oriented ×3, and of course I've gathered all my equipment and materials. Under another circumstance, I would have collected my vital signs and medical history from my patient. But right now, I'll just go straight to the point and without wasting much time. So, looking at my patient, and of course you always want to start by inspecting your patient. So I'm going to start by inspecting my patient, and I'm looking at him, and I can see that his head is proportionate to his body. His ears are symmetrical, his eyes are symmetrical, his nose is not deviated, his lips are pink and they're not cracked, okay? And I'm also going to be looking out for any lesions, any rashes, any kind of deformities, and any kind of swelling or redness around. So at this time, I'd like to start my assessment from the head, okay? So I'm looking at the head, and like I said, it's proportional with the body. And also, I'm going to start palpating at this time. I'm going to be wearing my, it's assumed that I'm putting on my gloves. So I'm going to start palpating the scalp, and I will be looking out for any infestations, and I'll be looking out for any kind of lesions, any scar, any kind of tenderness. Do you feel any pains?
Yeah.
No. Okay. So I'm going to be looking out for any signs of baldness, and at this time I don't see anything. All I can notice is that the hair is even, and everything seems intact. Okay. So also, since I'm in this region, I like to assess. I like to assess the cranial nerve 7, which is a facial nerve, and so I'm going to ask you to smile for me. I'm going to ask you to frown, puff your cheeks. Very good. So at this time, I can say that this particular cranial nerve is intact. And also, I'm looking around, and I'm going to be palpating and checking for any kind of tenderness. Okay. So I'm starting with the temporal sinuses. Do you feel any pains around here? Down to the I'm starting with the frontal. Sorry. Down to the temporal. Any pains? Okay, and then the maxilla. Any pains around here? No. Very good. So also, can you remove your glasses? So I'm also going to be checking his eye also, and I'm looking at his eyes. They're symmetrical, and I'm going to be checking. I'm going to check the conjunctivitis sac, and it's pink, and I don't see any kind of redness and swelling. Okay, the sclera is white, and the eyelids are evenly spread. You can wear your glasses now. Okay. So also, since I'm also in this region, I like to assess for optic nerve 2, which is cranial nerve 2, which is optic. Okay, and this will be checking for his vision acuity. So I'd like you to close one eye and read this line for me.
FPH.
Very good. Close your other eye too. Read the same.
FPH.
Very good. So at this time, I can say that he's 20/20 with corrective glasses. Okay, very good. So also, since I'm also in this region, I'm going to be checking for 3 other cranial nerves that are responsible for eye movements. And this will be cranial nerve 3, oculomotor, cranial nerve 4, trochlea, cranial nerve 6, abducens. So they all, check for involuntary movement of the eyes. So and I'm going to be using the 6 cardinal gaze to assess this. So I need you to just look at the pen. Do not move your head. Just concentrate, focus on this pen, okay? So just follow your eyes, anywhere this pen goes. I'm starting with this. Okay. So at this moment, I'm satisfied and I can comfortably say that those 3 cranial nerves are very much intact. I'll also be testing for convergence and accommodation. So I'm going to bring this closer to you, and what I see is your eyes, your pupil will be almost like, like you're crossing your eyes. So, and that just tests for accommodation. So bring it closer to your eyes, let's see. Okay, together. So this is assessing for convergence and the accommodation also. So since we're still in this region, I'll still go ahead and check your eyes. Can you take your glasses off, please? Okay. So I'm going to be testing for parallel, making sure that the pupil are constricting. I'm going to start from here. Constricting. I'm going to check the other eye as well. Constricting. Very good. Also, I'm going to be checking for the red reflex. Okay. Let's see. Right. Okay. I'm checking for all the vessels in the eyes, and everything seems good. And I see the red reflex. If the red reflex is not there, then that could be an indication that the patient could have cataract. You can wear your glasses back. Okay. So, also, I have concluded that the pupil are equal, round, and reacts to light and accommodation. So next, I'll be going to check your ears. Okay. All right. So I'm looking at my patient, and I'm starting from the outer part. Sorry, my hands are cold. Outer part of the ear, and I'm checking for any kind of redness, any kind of inflammation, and I don't see any. So I like to see the inner ear. I'm checking, starting from here. So I see the tympanic membrane. It's pearl gray, and it's translucent, and it's also shining. Also, I see the cone of light, and you're going to see the cone of light at 5 o'clock on the right ear. So let me check this other ear. nice and clean. The tympanic membrane is pearl gray, translucent, and it's shiny. And you get the cone of light at 7 o'clock on the left ear. Okay. So I'm also going to be performing the whisper test. So I'm going to close this ear and you tell me what I see.
Apple. 99.
Very good. So also I'm going to be performing the two tests that are used in detecting hair loss, the Rhine test and the Weber test. So for the Rhine test, I'm going to strike the fur and I put it here at the mastoid process. It will continue to vibrate even when it stops, and you put it closer to the ear, it still continues vibrating. Okay? So for the Weber, I strike this and place it on the head. It's expected that the patient is supposed to hear it both ways. It's going to be evenly distributed, the vibration. Okay. So also, since I'm here, I'm going to be testing for cranial nerve 8, acoustic, or vestibular cochlea. So, and it's confirmed when I whispered in the other eye, even though it was occluded, the other ear, patient repeated what I said. So that shows that that particular cranial nerve is intact. Okay, so now I want to test your gait, your coordination. Because sometimes it could be linked to the ears as well. Please, can you stand up for me? Can you go ahead? Can you walk to this place? Look. Come back. Okay, very good. So can you walk? Can you put your foot? Walk like this. One foot in front of you. Very good. And then go back, tiptoe, and go back. Very good, good job. So at this time I can bring this closer. I can comfortably say that my patient does not have his coordination ability is intact. So we're going to move to the nose. I'm looking at the nose right now, and it's in the middle. It's not deviated. It's intact. So I'm going to palpate the nose area. Do you feel any tenderness? No. Very good. Okay. So there are no drainages. I don't see any drainages, and I'm going to be checking for any occlusion, any blockage inside the nostril as well. So let's see this. I'm checking the mucous membrane is intact, and presence of nerve evenly distributed, no lesions, and everything seems intact. So since I'm here, I'm also going to use the opportunity to check, to assess for cranial nerve 1, which is olfactory. Okay, so I'm going to ask you to close your eyes and what do you smell? Tell me.
Cinnamon.
Very good. Close your eyes. What is this?
Coffee.
Very good. So, cranial nerve 1 is very much intact. So we're going to move over to the mouth. I'm looking at my patient's lips. It's not cracked. The lips are pink. And I'm going to go inside. I'm supposed to wear gloves. And can you open your mouth for me? Okay. So I'm going to look and check. Use my pen light. I'm going to be checking for any lesions and loose teeth, any cavities, And also raise your tongue, very good, because sometimes you have some hidden diseases under the tongue, and I can see that the tongue is not beefy, like you will see in anemic patients, and the tongue is pink. Also, I'm going to use this opportunity to assess cranial nerve 12, which is hypoglossal. Can you open your mouth again? I need you to bring out your tongue and wiggle it left, right. So yeah, so this nerve is very much intact. Also open your mouth again. Very good. So I'm going to use, I'm looking at a uvula, and when I depress this, it's going to it's going to activate my patient's reflex, gag reflex, and I want you to say ah. Okay. So I see that the uvula moved, and at this time, put it. So I'm going to also be assessing for cranial nerve 9, which is glossopharyngeal. Okay, and also I'm going to be assessing for cranial nerve 10, which is vagus. Okay, so my patient does not have any difficulty in swallowing anything, but I'm still going to assess for that. So can you just drink this water? Came out and drink the water just to make sure it's not deviated. Okay. All right. So this nerve is very much intact. Okay. So I'm going to be moving over to. I need to check the TMG as well. So I'm going to hold onto this place. And against, I need you to clench your teeth really hard. Okay, very good. Right now I'm assessing cranial nerve 5, trigeminal, which is responsible for mastication. So I can feel the muscles of the jaw very strong, and I also feel it here at the temporal area. Okay, this is fine. So I'm going to continue, and I'm coming down to the neck area. So I'm going to be assessing for the neck. Looking out, and I don't see any abnormal swelling, no abnormal nodes, and no discoloration, and I'm just going to palpate for tenderness. Do you feel any pains around here? No. Very good. Okay. So this time I'm going to mention some very important lymph nodes around the neck. So we'll start from here. This is the pre-auricular node, lymph node, and then you have the post-auricular here. Then you have the occipital here. Then you have the superficial cervical node here. You also have the superficial cervical deep chain around this area. And then you have the posterior cervical around here. And then you have the supraclavicular area around this area. Then you have the submandible here. And then this area you have the submental. Okay? So we're done with this area. But at the same time, I'm going to be checking for tenderness around this area, the shoulder. Okay? So at this time, I'm going to be assessing for cranial nerve 11, which is the use of the accessory, the shoulders. So I need you to shrug your shoulder against resistance. Take it up. Very good. So this muscle here is very much intact. But I'm just going to go ahead and palpate. Do you feel any kind of pain, any tenderness?
No.
No. Very good. So at this time, I want you to, this is part of shoulder range of motion. So I need you to turn left. Put your neck turn this way, and then turn right, very good. And then I need you to use this hand to scratch your neck, okay? And I also need you to, yeah, very good. I need you to be able to touch your left scapula. No, sit down, yeah.
Like this?
Very good. So, yeah, so those are the shoulder range of motion, okay? So also, I am going to now assess the upper extremities, and I'm starting with the fingers, the hands. Okay, so I'm looking and trying, I'm inspecting the fingernails of my patient, and I'm making sure it's not cyanic, it's not discolored. I'm going to be looking out for any kind of redness, any swelling, and any nodes around the joints. Because if you have any nodes around the joint, then it's an indication it could be osteoarthritis. So I'm going to be palpating. Do you have any pains in any node? No. Okay, let me see the other one too. Any pains?
No.
No. Okay, so at this time, I'm going to also assess for the cap refill. So, and it comes back, it returns almost immediately, less than 2 seconds. Same here, same here, same. I'm also going to be assessing, I'm going to be doing the toggle. I'm assessing, I'm making sure that, you know, the skin is hydrated, and it returns almost immediately. Okay, so for the fingers, you're going to just do very simple range of motion. It's going to be adduct, just do like this, spread out your hands, and then bring it back. Yeah, just like that. Yeah, that's a good exercise. Okay, that's fine. Also, I'm going to be assessing for the radial pulse, and I'm doing both of them at the same time so that I can compare. So they are both 2 pluses and same strength. So also I'm looking at the wrist, and I'm checking for any kind of inflammation, any swelling there. Do you feel any pains around here? No. So everything is fine. So for the wrist range of motion, you're just going to extend and flex. So just do this and this. Up and down, up and down. And then this, adduct, abduct, and adduct, like this. Yeah. So this is fine. Good. So I'm also going to be going to assess for the brachial pulse bilaterally. Like I said, it's 2 plus, and the range of motion, and I'm looking, and I don't see any inflammation, any sign of inflammation. There's no redness, there's no swelling. So for this one, you're just going to flex and, extend and flex here. So this will be for the elbow, just this and this, in and out, and that's fine. Okay. So also, if you happen to have a patient with a dialysis patient with AV fistula, you're going to be assessing for a trill around where the fistula is. Also, let me come back to the neck. When you're assessing the neck, you're going to assess for the carotid artery, okay? So it's around here, and then I can feel it, and it's good, 2 plus, bilaterally. So also we're going to be assessing for JVD extension when you get to the neck. So I need you to turn this way. So I'm looking at this area now of the neck where you find the JVD, and let's turn this way. And there are no extension there, okay? Now when you're palpating, please do not palpate both sides at the same time, because you could cut off blood circulation and drop your blood pressure. So you're just going to palpate, one side after the other, okay? And then also, when you're auscultating, when you want to listen, you're going to listen with your bell instead of the diaphragm, okay? Because the bell picks any kind of breathe sound easily, better than the diaphragm. So I'm just going to listen to this area. And I don't hear any swishy or turbulent sound at all. Okay, so we're done with this area. Next, we're going to be assessing for the deep tender reflex. Now, for the brachial radial, it's going to be, I'm going to use my hammer, and it's going to be around this area, and when I hit it, the tongue is expected to jump on impulse. So this is the reflex for the radial. So, and for the bicep, it's going to be around here. It's also the same thing. Hit it, it jumps. So for the tricep, it's going to be here, and then we hit the reflex. We'll hit the hammer on this area around the tip of the elbow. It jumps too. So assess that, and it's complete. So right now we're going to move to the chest area. So I need to see your chest too. Thank you. So I am going to assess the chest area. Right now I'm looking at it. There's no, everything looks very equal, symmetrical. I'm looking at his chest rise and fall, and he doesn't seem to be using any accessory muscles for breathing. So I'm just going to go ahead and listen to the heart sounds. So I'll start from this area. This is the aortic valve area. Okay, so it's gonna be on the second intercostal right sternum border. So we move over to this area, the left sternum border, second intercostal. This is where you have the pulmonic valve. So these areas you're going to hear the S2 loudest. So we come down a little, third intercostal area of the left sternum border. This is where you have the Epps point. Now underneath it is going to be the fourth intercostal space where you have the tricuspid valve. And then you come further down at the mid-clavicular area, you have the mitral valve there. You move a little further. So this is the point where you listen to the apical pulse for 1 minute. Okay? I'm going to do it. And then when you're done listening to the heart sounds with the diaphragm, you're going to turn and also repeat. You're going to use the bell this time around to listen to the hearts. You know why? Because the bell picks up abnormal sounds like murmur easily compared to the diaphragm. So that is clear. So also at this point, I'm just going to go ahead and assess for the thorax, the lungs. Just like I said, I can see that my patient is breathing normally. He's not in any kind of respiratory stress. The chest is rising and falling, and everything seems symmetrical. So I'm going to be listening to the lungs to the lung sounds. Okay? So most of the time when you listen to the lungs, you're actually going to listen for abnormal sounds like wheezing, stridor, or crackles. Okay? Start from here. Apex. Breathe in. Out. Out. So I'm comparing both sides. Okay. So I'm also going to percuss. Make sure you don't percuss over the bones, because if you percuss over the bones, you're going to hear very dull sounds. So you're going to percuss, and the chest itself, you should hear resonant sounds and not just, dull sounds. Okay. Okay, so I'm going to do the same at the back also. I'm going to be listening to the lungs also. Make sure you're listening in between the ribs, not over the bones. Lower lung. Everything seems fine, no abnormality. We do this thing here. So also, yeah, I'll also be percussing. So I'm going to use this opportunity also to assess or perform the diaphragmic excursion. So I'm going to get to the 10th rib, and I'll place my two thumbs like this. Breathe. Stay up. And breathe. So once the patient breathes, any breath is once he takes his breath, it's supposed to separate my thumb, and that is very normal. And also, I'm going to be assessing for the respiratory excursion. So I'm going to place my thumb here on the xylose process. I need you to breathe. In breath, out. Okay. So it separates, meaning that it's very, very normal. At this time, I also want to perform the axillary nodes. I want to check for the axillary nodes. So this is how you check for it. So I'm just going to start from here and just place this hand, use my dominant hand over the shoulder or clavicle, and then palpate. Palpating and checking for any kind of abnormal, abnormally big nodes. I don't see any. So I'm also going to be checking for epitrochlear nodes around this area. So just normal. Okay, everything seems good. Also, I want to use the opportunity, since I'm at the back now, to also assess for CVA. This is usually done for patients who um, having pains or around the pelvic area, or you're suspecting that your patient might have some kind of kidney infection. So I'm just gonna and palpate this area and use my fist here. This is a CVA assessment. Do you feel any pains?
No.
Okay. All right. That's fine. So we're done with this section. So also, and since we're at the back, I just want to do everything before we go over to the abdomen. Can you stand up for me, please? Okay. Now, first of all, I'm going to be palpating here. And I'm going to also start from the C7 of the spine. I'm going to walk my fingers down, palpating. Do you any pains?
No.
No. Very good. Okay. All right. So can you bend down for me? Can you touch your toes? Okay. So I'm just going to use this opportunity to assess and check if patient has sclerosis, but he doesn't. He can get up. Then can you extend your neck like this? Just put it back. Okay. Very good. Nice. That's fine. Also, come this area. I need you to. These are a range of motions for cervical, thoracic, the spine. So I need you to naturally bend down this way and this way too. Very good. And the other way. Very good. And also to rotate like this. Good job. Fine. So we're done with that area now. So next, we're going to go to the abdomen section. Just going to be quick. I don't know. We're just going to manage. Manage this thing. But here, let me take this out. Me too. Let me take this out of the way. Okay. Yep. Sorry, just lie here. Okay, just lie down here. Okay. So we're going to go assessing. We're going to assess the abdomen. Okay. The abdomen has a different way of being assessed. So first of all, we're going to look, inspect, auscultate, percuss, and then palpate, okay? So I'm looking at my patient's abdomen, and I don't see any pulsation around the aortic area. And I'm looking at the shape of the stomach, the contour of the stomach, and it's a little round. So we're going to start auscultation. So I'm going to start listening to the stomach, and I'm going to do it clockwise. So I'll start from the lower. Okay. So I'm going to start from the lower right quadrant. This area actually is the appendix area. Okay, so I'll be listening, and remember that normal sounds are between 5 to 30 per minute. And I move over to the right upper quadrant. This is where you have the liver and the gallbladder, which is a little tucked under the liver. Okay, then we move over to the left upper quadrant. This is the area where you have the spleen. Okay, then down to the left lower quadrant. This is the area where you have the colon. Okay, so yeah, and then I'm going to percuss the abdomen just the same way again. And most of the time you hear tympanic sounds. You only hear dull sounds over bone or over any kind of mass or fluid. So percussed, and then the next thing we're going to do is, okay, after listening to the four sides, before percussion actually, because you might just stimulate, you don't do anything before listening to the sounds. If so, after listening to the four sides, four quadrants, I am going to listen also to the aortic area, and this time around I'm going to use my bell instead of diaphragm. Okay, so we're going to be listening to vascular sounds. So I'm going to place it here, and I'll be listening. I'm supposed to be listening for breaths, but I don't hear any. Okay, so remember that the aortic artery is split into two, which is the iliac and the renal. So I'm going to be listening to the left renal artery and the right renal artery. Everything seems normal. And then the iliac, left iliac. And then also we'll listen to the femoral artery here, and then here. Okay? So before you percuss, you have to finish listening to all the sound before percussion. So also now I'm going to start palpating for any type of mass, or just to feel the structures and make sure that everything is normal. So I'm going to start with light palpation. I'm going to start palpating. So it's just going to be here. Any tenderness? So usually it's going to be like about 2 centimeters deep when you're palpating, okay, lightly. So and then I'm going to do deep palpation, which is going to be like, it's deep, so it's almost double what you did first. It's going to be like about 4, you use about 4 centimeters to go in. Okay, here and here. Okay. Okay. And that's it. Everything seems normal. Now I'm going to measure the liver span. Okay? So we're going to percuss. Of course, you're going to hear tympanic sounds most of the time, and then you stop percussing at a point where you start hearing dullness. Okay, so this is where I start hearing dullness because it's over the bone, around the liver area. Okay, so I'm going to start from here again, and then percuss, and I'm going to stop where it starts being dull. So it stops here. So between here and here is what you call the liver span. So you can measure it, and it's usually between 4 cm and 7 cm. Okay, so you can sit up. Sorry, what's your head? Yeah. So that's fine for the abdomen. Now we're going to come down to the lower extremities. Okay. So also I'm going to be, I just forgot, should have worn shorts. Okay, so I'm going to be inspecting for any kind of swelling, edema. I'm going to be checking for any kind of inflammation, any kind of abnormalities, deformity and redness, and I don't see any. Before I forget, there's something very important. For the upper extremities, I need to test your strength, your grip. So I need you to squeeze my fingers. No, use this, squeeze it hard, very good. Now also push against resistance, very good. So I'm looking at this and everything seems fine. There's no edema, there's no redness, there's no inflammation. And I'm checking for cap refill and it returns almost immediately. This is less than 2 seconds. Okay? So I'm going to be checking and making sure that there are no lesions and no cuts, no wound. And that's it. So at this time, for range of motion for the toes, you can just wiggle your toes. You can just do this, you know, wiggle your toes. And also, you can lie down a bit. And I need you to push on my palm. Yeah, for resistance. Very good, strong. Okay, so this is intact. Now also, I'm going to be assessing for the pulses of the knee. Okay, so I'm going to do it bilaterally. So I'm checking for both pulses of popliteal, and I see it, and it's normal, 2+. Very good. So, and I'm coming, and I still have to check for the posterior pulses too of the tibia, posterior tibia pulses, and it's +2, 2+. Okay. So I'm checking here for dorsalis pedis pulse, and I'm also comparing, and it's 2+. Okay. Fine. Also, I'm going to perform the Babinski reflex, okay, on you. And so I'm going to use this on under the feet, the foot, and then I expect it to coil. Yeah. And this is normal. Very good, especially found in newborns, babies, or toddlers, babies, young kids. Also, could you? Yes, I'm going to be testing for deep. I'm going to be testing the DTS, the reflex also on the patella. Okay, so. I'll be like this and put it this way, and when I hit this, it's going to jump. So it's only on impulse. So this is seen, and this is supposed to be natural. Okay. So I need you to. Sorry. What else again? So with this, I also. One more thing. Let's see. One more. Oh, okay. Careful. So just like way back. Okay, way back. So for the range of motion for the knees, it's gonna be you stretch it out, and then you take it, you release it up, closer to your chest, yeah, and then out again, and then back again to the chest, yeah. And then for the hips, it's going to be abduct this way, and then adduct this way, okay? Adduct and adduct. Then for the elbow, it's just going to be this way. Sorry, maybe you just sit up or something. Sorry, I think we're done like that. For the elbow, it's just like this. Or you can even raise the shoulders and then down. And for the elbow, maybe, extension, flexion, like that. Okay. So, what else? Am I forgetting anything? And I think this concludes my assessment. Yeah.